Hi, I'm Gokul Kanda Swamy, one of the Consultant Urological Surgeons working in Swansea Bay University Hospital, and also I'm doing my private work here in Santa Maria Hospital. So, benign prostatic hyperplasia is one of a physiological change that happens in men with aging. It happens in almost every male beyond a certain age. Among some of the physiological process of aging, prostate enlargement is also one among them. So it almost happens in every male patient associated with aging. The Urolift is a minimally invasive surgical option for patients who require surgery for some of their prostate problems. This very simply involves placing implants to lift the prostate lobes that fall into the urinary channel and thereby block the flow of urine. So these implants lift these lobes of prostate that block the channel and keep it lifted all the time, ensuring a decent flow channel so that the patients can pass urine comfortably after that. So the Urolift is suitable for a very selected cohort of patients. So in those patients who are carefully selected for the procedure, this procedure is very successful. There have been plenty of trials, including randomized control trials regarding this procedure, and we have seen repeatedly in all these studies the success rate is well above 80-90%. And in fact, very recently the procedure has been extended to patients who were in retention and people who are on catheter for a while because of retention, and when they were offered this Urolift, they have been catheter free within the first month in about 80% plus of patients. So as I said, this is a minimally invasive procedure, so the patients can go home the same day. These procedures are done as day case procedures. So basically, once you recover from anesthesia and you have passed urine for the first time, then we will let you go home. So the two common things patients notice after going home is seeing some blood in urine, because it is an invasive test, putting some implants into the prostate, so obviously they will expect some bleeding in the urine. But these are just a general discoloration, and usually nothing more than that, and that will settle down on its own. And some patients do notice a little bit of what we call as a storage symptoms, which is of urgency and frequency to pass urine. And again, this is a self-limiting side effect, and it usually takes few days, maybe a few weeks at the most, and this will settle down as well. So there are no major side effects associated with the procedure apart from what I have described earlier. The biggest advantage with Urolift is that it has no sexual dysfunction as its side effect. In fact, any surgical procedure on prostate, even the novel minimally invasive procedures other than Urolift, they all come with at some cost to its sexual function. And Urolift is the only procedure which has repeatedly been shown in studies to have absolutely no impact on sexual function. Most surgical procedures on the prostate involve a period of catheterization. In some cases, it may be just for a few hours, and in some cases, some sort of surgical procedures, it can be for a few days. But in Urolift, we do not place any catheter at all after the surgery, and you basically walk home passing urine normally after the operation. We do offer Urolift in Santa Maria Hospital, apart from other conventional prostate surgical options as well.